Hi, I just wanted to give you a couple of recommendations that will likely help decrease your infant's chances of getting decay in their childhood. Visiting a dentist or a dental hygienist in that first year of life is very important to establish a dental home and help implement things that are going to help keep your child's teeth at their healthiest. It's mostly recommended now that they would come in within 6 months of their first tooth erupting. What's done at that time is it's more of an appointment with the parent and the caregiver or care provider at the dental office, the hygienist, and there's a series of questions that are went through to determine if your baby is at a higher or lower risk of getting decay throughout their childhood. And once that's determined, we can then implement things that are going to keep your child's teeth their healthiest. And basically, if we come out and your child's at a very low risk, things are going to be relatively simple. I'll review some brushing and have you come back probably in a year. So let's say your child's more of a high risk of getting decay. Instead of just reviewing some brushing, we go into greater detail. I would be placing a fluoride varnish on top of their tooth, which is going to stay on their teeth for about 4 to 6 hours. And what that does is it really allows it to penetrate into the tooth and use up as much of the fluoride as possible to keep their teeth strong and healthy. Would review some brushing as well. You always want to use a very small smear of fluoride toothpaste on their toothbrush. For when you're brushing, you want to be brushing morning and night. As you're nursing, you want to be have something by you, like a warm washcloth that you can just go and get that child used to feeling that clean feeling after they're done eating. So you just go in and wipe off the excess off their teeth. If they've been found to be a higher risk, I'd probably suggest a product, something like this, that's called MI Paste. And what it is it has calcium and phosphate in it. These are two nutrients that actually leave the tooth as the decay process starts. And what we're doing is we're putting it back into the tooth. One thing to watch when thinking about a product like this is it actually is made from a derivative of a milk protein. So your children that have lactose intolerance are not going to be a candidate for the MI paste, but it's an excellent add-on to what you're already doing to help decrease risks of decay. And so basically you just smear it on your child's tooth, you leave it there for about 5 minutes, remove it with a cotton or a baby washcloth. Anything that remains on the tooth, that's okay.